When should a tracheostomy be done in ICU? I explained the timing as well. My name is Patrik Hutzel from intensivcarehotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, control, power and influence, making sure your loved one gets best care and treatment always, even if you're not a doctor or a nurse in intensive. Today, I want to answer a really common question that I get all the time from families in intensive care. And the question is, how long should a patient be on a ventilator before having a tracheostomy? Now, here's the short version first. Most intensive care units will start talking about a tracheostomy if your loved one can't come off the breathing tube within 7 to 14 days. That's the general guideline and rule of thumb. But here is where it gets interesting. Just because doctors say it's time for a tracheostomy at day 7, day 10, or day 14 doesn't mean you have to automatically agree. Every situation is different. For example, if your loved one is slowly waking up from an induced coma, if they're improving step by step, it might be worth waiting a little longer to see if they can be extubated successfully. Extubation means the removal of the breathing tube. Now, also, the first question that you need to ask here is the intensive care team doing everything beyond the shadow of a doubt to wean your critically ill loved one the breathing tube and try to extubate them? That's the first most important question. The second important question is, are they doing everything beyond the shadow of a doubt to avoid the tracheostomy? Now, a tracheostomy has its time and its place, but you've got to rule out that it definitely had its time, you've got to confirm that it definitely has its time and its place. On the other hand, if your loved one is not waking up at all, if they still need deep sedation and opiates, so if they can't handle being off the ventilator for even short periods, if they're fighting against the ventilator, if they have other complications, such as pneumothoraxes, awaiting surgery, they are in ARDS, have high PEEP, have high FiO2 requirements, then a tracheostomy might actually be the safer option. But you need to ask a lot of questions to find out. So really, the right question is not just when, but what is the plan for weaning off the ventilator? And I've made a video, how to wean a critically ill patient off the ventilator and the breathing tube, that I encourage you to check out. I'll link towards it in the written version of this blog. Is my loved one ready for extubation? What happens if we delay a tracheostomy? What happens if we go ahead with it? And what are the long-term options after a tracheostomy, long-term ICU, or intensive care at home? And you can find out more information at intensivcareathome.com. Families in intensive care often tell me they feel rushed into making these decisions, but here's the truth. You don't have to rush. You need the full picture. You need options. You need to ask the right questions before agreeing to anything. And that's exactly what I help families in intensive care do. Take back control, get peace of mind, and influence decision-making fast in intensive care so that your loved one gets best care and treatment always. How do we do that? I'm glad you asked. Number one, you and I get on a call with the doctors and the nurses or the RT, senior staff in ICU. Number two, get access to all medical records so that we can look at everything and leave no stone unturned. You will be surprised of what you learn once you look at it from the outside, from a different professional eye, and you will see that the dynamics will change in your favor. So if you need help with making a decision around a tracheostomy or any other critical and potentially life or death situation in ICU, go to intensivcarehotline.com and call me on one of the numbers on the top of the website, or book a call with me on the website. I offer one-on-one consulting and advocacy for families in intensive care, and most importantly, I offer proven results. I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years in intensive care. And I've been consulting and advocating for families in intensive care since 2013 here at intensivcarehotline.com. And I can very, very, very confidently say that we have saved many lives with our consulting and advocacy because of our insights, and you can verify that on our testimonial section at intensivcarehotline.com, and you can verify it on our intensivcarehotline.com podcast section, where we have done client interviews. And because our advice is absolutely life-changing, right? The biggest challenge for families in intensive care is simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. And that's why we help you to improve your life instantly, making sure you make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And that's why you can join a growing number of members and clients that we have helped over the years, saving their loved ones' lives. And that's why I do one-on-one consulting and advocacy over the phone, Zoom, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. And when I talk to families directly, I also talk to doctors and nurses directly, asking all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care. So if in case you have unanswered questions, if you need closure or if you are suspecting medical negligence. We also have a membership for families of critically ill patients in intensive care, and you can become a member if you go to intensivecarehotline.com, if you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in a membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I've personally written and recorded. And all of that will help you to improve your life instantly, make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my video, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next, what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification from the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivecarehotline.com email newsletter at intensivecarehotline.com. Thank you so much for watching. This is Patrik Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.